Welcome back to BrainWaves. I'm Jim Siegler.
And I'm Erica Mejia. So,
Quanta.
This idea came up because I thought that listening to your podcast as a non-neurologist, I had trouble following all the different pathways and processes that you were describing. And there were times where I wished that I could go back and reference a very short, brief episode about the basics of the physiology.
Snippets of information, these little packets of data that you can reference when you're listening to an episode. So who came up with the idea for Quanta?
Me!
Yep, that's right. My beautiful and intelligent wife-to-be. So in that light, here's our first segment of Quanta.
And it's going to feature a segment by Dr. Chatterjee,
cognitive neuroscientist.
There are three things that every neurologist should know how to assess at the bedside. The first is just fluency, and that's an observational thing. And people typically with Broca's aphasia are effortful and don't produce a lot of words.
Towel, soft, shower.
It is common, I think, for people to talk about have someone having an expressive aphasia. I would encourage people not to use that term because people with both Broca's and Wernicke's aphasia can have expression problems. And if you just refer to someone as having an expressive aphasia, it's not clear what is actually being referred.
So when there's a deficit in production of speech, we usually call this a motor aphasia.
But fluency is simply about the rate at which words are being produced.
Here, Dr. Chatterjee and I are both clearly fluent. Our speech prosody is normal, and thoughts coherently flow together as we speak. But sometimes a patient can be fluent and speak in gibberish.
For now smells like certainly the house plays fair ground, time to go shopping, dog fellow, wine time.
This is a fluent aphasia, kind of jokingly called a word salad or Wernicke's aphasia or a receptive aphasia.
And then you have the question of comprehension. And comprehension also tends to have a hierarchy, which is that very simple commands are easily understood. And the more complex the commands get, the harder they are to understand. But comprehension needs to be assessed.
Again, this is what defines the receptive aphasia, a deficit in comprehension.
And then the third piece, which in some ways is tested the least, but maybe the most useful with respect to classifying and thinking of what parts of the brain might be involved, is repetition.
No ifs, ands, or buts.
No ifs, ands, or buts.
And the key in repetition is what you are interested in is whether a person can hear a series of sounds and convert that into a motor program. So the less meaning you have, which is you're not using words with a lot of meaning.
How now, brown cow?
The better your test for repetition is.
How now, brown cow?
Which is why we typically use things like no ifs, ands, or buts, because those words don't have intrinsic meaning. Okay, so now you have these three things: fluency, repetition, and comprehension. And from that, you can classify patients based on the kinds of deficits they have. So if someone has a deficit in all three, we call that a global aphasia. If someone has a deficit in repetition and production, we call that Broca's aphasia. If it's repetition and comprehension, we call that Wernicke's aphasia. If they only have problem with production, we call that a transcortical motor aphasia. If it's only a problem with comprehension, we call that a transcortical sensory aphasia.
And if there's only a problem in repetition, that's called a conduction aphasia. As far as why it's critical to be sure to test all three,
fluency, comprehension, and repetition,
they have a unique localizing value. And from a cerebrovascular perspective, it even gives you greater insight into an underlying cause for why that particular area is affected. To hear more about this, you'll just have to wait for Anjan Chatterjee's full episode on linguistics, episode number 63, coming up in a few weeks.
Woohoo! But that's all we have for you in this segment of Quanta. Stay tuned for more pearls in the weeks to come. I'm Erica Mejia.
And I'm Jim Siegler. We'll see you next time.
The production staff for this episode included Jim Siegler and Erica Mejia. Music by Kevin MacLeod. A warm thanks to Dr. Anjan Chatterjee for joining us on this segment. Be sure to check us out next Thursday when Dr. Chatterjee talks more about cognitive neuroscience and what he calls cosmetic neurology.